Hello, 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 hello. My name is Nurse Wisteria, and welcome to the Rosewood Asylum. So, I am here to check you in today, which we seen your chart earlier today, so we're just gonna get right into it. If that is okay with you. Okay with you, great. Okay. So, can I start off by getting your name, please? I mean, even though they said over the, yeah, okay. Yep, no problem. And your last name. Perfect, thank you. And your date of birth, please. Yep. Perfect, thank you. And your address. It's just for the files. Yep. This shouldn't take very long. And your phone number. Yeah. Since it's your first time here, we have to go through the paperwork like this. And then the next time we'll already have it. But there's other amenities here that we offer at the Rosewood Asylum as well. Yeah, I know it says for the critically insane, but we don't like to quote people as critically insane. No. We're just people that deal with issues. That's what I would claim that. And the reason why you're here. Yep. Okay. And you checked yourself in, right? Okay, good. Great. And okay. Thank you. Okay. Anxiety. Okay, good. And any medical history that I should know about? Okay, just that. Alright. And any, well, yeah, mental health issues in the past month. You said anxiety. Okay. And any other mental health diagnosed changes for any reason? No. Okay. And medication, you said just an inhaler, right? For that issue. And then mental health, we already distributed that it was anxiety and depression. That's exactly right. And your insurance is with who? Great. Thank you. And have you had a therapist or a psychiatrist in the past years? Yes. Okay. And your social security number? Great. Okay. And any anxious thoughts as to today or this past week? Yes. Okay. That is all I need from you information-wise. So now I'm just going to look over this file of yours real quick. Is that okay? Okay, good. Yes, okay. Okay, everything seems to check out. Okay, so what I'm going to do is I'm going to put on some gloves because we are going to do some testing, if that is okay with you. Great. Truly just to see where the anxiety stems from. Alright, great. Okay. So, let me get this other glove on for us. Good. Yeah, we don't usually like to take very long on the paperwork because our goal is to help you, not so much pay to attention. Well, we do pay attention to the paperwork and the file that you have on site, but we mainly care about your mental health. So I'm just gonna do this. We're just gonna fill your face a little bit, face a little bit, because people that come in here with severe mental health issues like schizophrenia and stuff, we do more. We do more invasive testing. So when you're checking, we don't need to do that, because if you do know that schizophrenia, it causes like voices, hallucinations, things like that, which you are not suffering from, so you don't have to do that. Okay, you're fine with that? Okay, good. All right, let me see something here. Now, I just want you to follow my finger up quick. There we go, thank you. And down, good. And up real quick. And down, good. And this way, good. And that way, good. And this way. Over here, good. And down, good. Back up again. And down again. That way. And go back, good. And that way. And go back, good. And that way. And go back. And down again. And up again. Go that way. Go that way. Go that way. Good. Okay. So everything seems to be checking out, especially with your eyesight and different things like that, which is good because we need to do a medical exam. And during this time, we will set you up with a psychiatrist, which will do invasive testing for the type of anxiety that you have. Because there are a couple of categories, like I said, there's generalized, there's panic disorder, there's social disorder, social anxiety. You know, yeah. Now, what I want to do is I just want to test if you can feel that. Good. Alright. So, yeah. You can feel that okay? Good. Now, we don't do lobotomies here. I don't know who told you that. We feel like that is not a good practice. Not a good practice. Good practice to do on people with mental health issues. We don't believe in that. And there is no scientific proof that it cures anything. So, no. Okay, good. I'm just gonna poke. Can you feel that okay? Good. Good. But yeah, we don't do any tests that is harmful to the patient or is gonna cause any severe issues, problems, anything like that. We don't believe in that. I think it's a really sad thing that the way that things were ran back in the day, because, you know, they thought of everything as something crucially needs to be done, and that's not what we do here. No, we treat our people like human beings and not, you know, exactly. So I'm just gonna take your temperature real quick. Just take your temperature real quick because you said the nurse did your like heart rate and blood pressure and things. Okay, good. I'm just gonna hold that under your tongue for me. Okay, yep, that's good. But yeah, we don't believe in inhumane practices here. Yep. Okay. Now I have to see here. I actually have to stamp this for approval to make, you know, to let them know that I did. I'll write that down. Okay. Now, one thing I do need to do is I need to talk about this real quick. This is one of the tests that you'll be doing with me the next time that you see me. This is called the reflection test. This basically is going to see what causes your anxiety and how it comes about, because usually anxiety can be triggered by, you know, anything, but sometimes it's unknown causes, sometimes it's fears. So we are going to make sure, because this will reflect any of anxious thoughts, memories, anything that you hold on to. This mirror shows what is you are deeply afraid of. So that is what this is going to be for the next time that you see me. And the last two things that I have to do is schedule you up with a therapist and psychiatrist. So the next time you see me, we will do the reflection test, and then we will do the psychiatrist and therapist setting up. And then the last thing I need to do before I let you go is I have to look in your ears and your mouth. Well, not so much the ears, but they're afraid that you hide stuff in your mouth. So I'm just gonna look here. Just gonna pull down that ear there. Yep, it looks good. And pull down this ear over here. Good. And just go like that. Just good. And hold up your tongue for me, like that. Good. Yeah, I don't see anything. But it was good talking with you, and I can't wait to see you again.